So this is a sinus drainage technique. I'm going to be demonstrating direct pressure and milking of the frontal sinus and maxillary sinus. And so these are going to increase venous and lymphatic flow, help relieve obstructions, and also help with mucociliary clearance. So for the frontal sinus, you're going to want to place your fingers on the supraorbital notch. And you're going to move your fingers back and forth rhythmically a few times, and this is going to wake up the nerves in the area in the autonomic nervous system. And then you're going to apply pressure and sweep your fingers around and through to the cheekbones. And you're going to do this, the stroking motion, 6 to 8 times. And then for the maxillary sinus, you want your fingers to be at the infraorbital notch. And it's the same thing where you move your fingers a few times to wake up the nerves, and then you stroke your fingers through the cheekbones. All right, so we're going to do lymphatic pumps, and this is bilateral dorsiflexion and plantar flexion with make and break traction. So this is if your patient has edema or swelling in their lower extremity, it's to mobilize the fluids. Some counterindications are cancer, osteoporosis, and necrotizing fasciitis. So to do this, you're going to bring your patient into dorsiflexion, bring them to a barrier, and then just sort of pump their feet. It's small motions. You want to be about 40 to 60 beats per minute. And it's sort of like you're playing with the paddle ball, where you want to hit the ball when it comes back down. And you can kind of look at the motion of their legs to figure out where that would be. And the dorsiflexion is going to also be good for the posterior fascia, and the plantar flexion is going to be good for the anterior fascia to break it up in the leg. Plantar flexion, you're going to bring them into that barrier, and same thing, small motions, 40 to 60 beats per minute. And that's lymphatic pumps. So I'm going to be demonstrating sacroiliac articulation, which is an articulatory technique, so it's direct and passive. And you use this technique before another treatment just to kind of loosen things up. So the first thing you're going to do is contact your patient's ASIS, push posterior medially on both sides, and just feel for motion. And so whichever side feels a little bit more stuck, you're going to have them lie with that side facing up. Switch lie on your side, please. You're going to contact their sacrum at S2 and apply an anterior pressure. You're going to scoop their leg up, so you're holding their knee. Ask your patient to take a deep breath in and hold it. And you're just kind of going to move their leg around. And then you can tell them to breathe normally again. And you can do it a few times. You just have to be conscious that your patient is holding their breath. And then you'd ask them to lie on their back again and recheck. So I'm going to be demonstrating a bilateral flexion of the sacrum. So for this, you would have an equivocal seated flexion test, a deep sacral sulcuses on both sides, and prominent ILAs on both sides. So you're going to have your patient seated with their feet contacting the floor. You're going to ask them to bring their knees together and their feet apart, and this is going to gap the sacrum in the front. You're going to take your fist and contact the base of the sacrum at the apex, and you're going to have your patient lean forward until you feel motion. Right there, stop. I'm going to put my hand on the back of her shoulders, and I'm going to apply an anterior pressure while I ask her to sit up. Resist for 5 seconds. Ask her to relax. Wait for post-isometric relaxation. Bring her forward a little bit more into the new feather's edge. Ask her to sit up again. And you can repeat that 3 to 5 times. Okay, relax. And when you're done, recheck your diagnosis.